So, hey guys, Deepak here, and here I am to help you to know what exactly diabetes is. So, before going deep into it, before knowing what exactly diabetes is, we will be covering some general talks about our body. See, our body is divided into organs. Our body has different parts, different organs, and every organ has different functions to play. Okay, similarly, our body has pancreas, a part called pancreas, and on this pancreas complete diabetes topic is dependent on. Okay, so see what pancreas is also having some function to play, and pancreas function is to produce or secrete insulin into our body. Okay, and insulin, the secretion of insulin, pancreas will secrete insulin. Okay, and what insulin will do is, insulin is also having some function. Insulin will move the sugar or glucose from the blood to cell to produce energy. Okay, insulin function is to move the glucose or sugar molecules from the blood to the cell to produce energy. Okay, this is the function of pancreas, insulin. So complete diabetic topic is dependent on these two terms called insulin and pancreas. So you need to remember what pancreas will do. Pancreas will secrete insulin, and insulin will move the sugar or glucose molecule from the blood to cells. Okay, you need to understand this. Okay, coming what exactly diabetes. So diabetes is also divided into subcategories, and depending on the secretion of insulin, it is divided into three types. Okay, so we generally talk only diabetes, but there is subcategories under diabetes called type 1 diabetes, type 2 diabetes, and gestational diabetes. Okay, so you see what is type 1 diabetes. Generally, type 1 diabetes refers to faulty pancreas. Okay, generally type 1 diabetes refers to faulty pancreas, where pancreas is incapable of producing any insulin. Type 1 diabetes refers to faulty pancreas, where pancreas is completely incapable of producing insulin. And it is due to, why it is incapable of producing any insulin, is because of it is because it is attacked by its cell only, where pancreas cell is destroyed. So it is generally termed in science, it is called autoimmune reaction, where the body is attacked by itself. And what the cells is producing insulin is called beta cells. Okay, in type 1 diabetes, beta cell is destroyed by itself. Okay, and coming to type 2 diabetes, see what is type 2 diabetes. So it is the more or most common type of diabetes. Type 2 diabetes is most common. Usually it occurs, it is seen in 90% of the diabetic patients, and it is due to three reasons. It is due to three reasons that 90% people get type 2 diabetes. Okay, and the first reason is heredity. Heredity means, if any family member is suffering with diabetes, if any family member is under medication of diabetes, or he or she is having diabetes, the offspring is also having chances of getting diabetes. This is the first reason. Second reason is lifestyle. Depending on the lifestyle of the person, how he is living, how he is doing in his life, the diabetes have chances to come. Okay, and third reason is being obesity, being overweight. If a person is having more than its ideal weight, or a person is fat from so many years, he is having chances of getting diabetes. These are the three reasons where type 2 diabetes occurs. Okay, hope you got what is type 2 diabetes. Okay, and coming to the third type of diabetes, it is gestational diabetes. What is gestational diabetes? It is for ladies, it is for pregnant women who can't make insulin during their pregnancy time, during their late pregnancy or pregnancy time. Pregnant who are incapable of producing, or their pancreas is incapable of making enough insulin, they come under the gestational diabetes, and they are having more chances to come under the category of type 2 diabetes also. Okay, and it is because of gaining too much weight during the pregnancy. time of pregnancy. Okay, hope you got gestational diabetes also. What is gestational diabetes? So here we are just covering the general talks about diabetes. Okay, now what are the causes? You see, the first cause is obesity. If any person is getting diabetes or is under diabetic medication, so the first reason will be obesity to get into it. And the second reason is lifestyle, how he is maintaining his life, whether it is active or sedentary. It is completely dependent on the person lifestyle. Third reason is eating habits. Eating habits is also a major part of what he is eating, how he is eating. This is also plays a major role of getting diabetes or the causes of diabetes. And the fourth reason is sleep. Improper sleep for the days together can also lead to diabetes. Coming to the symptoms, what are the symptoms seen when people get diabetes? The first symptom is frequent urination. The second reason is the person feels thirsty, tends to feel thirsty. And the third reason is he or she lose weight without trying, without doing any external activities or without doing any exercises, they lose weight. Okay, and the other reason is having blurry vision. Having blurry vision also is a symptom of having diabetes, whether it is type 1, type 2 or gestational diabetes. Okay, or having numbness in the thighs, feet. This is also a symptom of having diabetes. Okay, and see how to cure. The question comes, how to cure the diabetes? So for type 1, there is no cure till now. Coming to type 2 diabetes, type 2 diabetes can be cured easily by just following some methods. Okay, and by doing some exercise. You need to first lose weight to get cure of diabetes. Improve your diet and improve your sleep quality, sleeping habits, lifestyle. You need to improve it. Okay, then you can overcome or get cured of type 2 diabetes or gestational diabetes. For type 1, there is no medication till now, or there is no certain cure, certain medication or certain medicine to get cure of, where type 1 diabetes can be cured. How to prevent? Okay, you can prevent whoever are pre-diabetic or whoever are like having little symptom or getting obesity. You need to just get precaution, or just you need to prevent from getting into medication. You need to just improve your qualities of exercising, diet planning, and getting proper sleep. Okay, you just need to improve your habits. Okay, thank you so much. So this was the general terms, general talks about diabetes, and we will be covering deep into it, how to overcome diet planning, what are the exercises to be done, what to eat, what not to eat in the time of diabetes, and how you can get cured as soon as possible with the diet. We will be uploading video as soon as possible. So do subscribe the channel to get updates about our videos, upcoming videos. So thank you so much. Hope you got what diabetes exactly is. Okay, and soon we will be uploading the videos on it. Thank you so much. Do subscribe now.